My name is Rebecca MacFalda, and I am a genetic counselor at UP Health System Marquette. The goal of genetic counseling is to help an individual understand a potential hereditary risk factor, the implications it can have on their health, and how it should best be managed. We also educate patients on how it can be passed through families, so the implications not only on that person, but how this could also affect siblings, children, cousins, what have you. Usually the people I see in clinic are patients who either have a personal history of cancer diagnosed at a young age, who have an unusual type of cancer, or a pattern that's in their family that's raised some concern. We go over, their interests, their concerns. I review their family history, their personal history, and determine how likely it is that they could carry a hereditary cancer gene. And then I spend time with the patient educating them on what that would mean, what the clinical implications would be, what options would be available for them in terms either of increased screening or risk reduction measures that they may take. And then we sort of help guide them through that genetic testing process if they're interested in doing that. And then most of our follow-up is done by phone, so it's usually just one time in the clinic with me. The point of coming in to sit down with a genetic counselor is to gather information. It's to get the information they need to help make their personal decision whether or not they want to pursue genetic testing. If they decide to undergo the genetic testing, it's typically done by a blood draw. It's just a one tube of blood, similar to having your cholesterol checked. It's not any more than that. So the patient involvement is pretty minimal. But it usually takes about 2 to 3 weeks or so for results to come back. But once we have that solid piece of information, we then go through and again by phone, and just in terms of what does this mean for you, what does it mean for your family members, and where do we go from here. I really like how integrated our program is, where as a genetic counselor, I'm working directly with the oncology team. I think it's better for patient care when we're all kind of taking care of different aspects of the patient, but we're all right there together. It's just a conversation. That's really all you're committing to, and it's I'm pretty easy to talk to. Just sitting down for a 45-minute conversation with me, it really clears up a lot of information for patients, gets their questions answered.